Welcome to Insights into Northeast Michigan, a WBKB News public affairs program. Insights deals with the issues affecting those within the community, as well as Northeast Michigan and the state. And now, Insights into Northeast Michigan.
Welcome to Insights. I'm Sherry Stewart. There's a lot happening this month. One of our focus areas is mental health, as May is recognized as Mental Health Awareness Month. Now, given the impact of the pandemic on our mental health, we've got a lot of ground to cover. Today, we're talking to experts who can weigh in on the stigma associated with treatment for behavioral health and the benefits of prioritizing wellness in the workplace. We're bringing you all of that and more on today's show. Well, joining us to kick off the conversation today is Dr. Rick Boone. He is a licensed clinical psychologist and the clinical director with Warriors Heart. Welcome, Dr. Boone.
Good morning, Sherry. Nice to be with you this morning.
Yeah, absolutely. Glad that you can kick off this important conversation with us. Before we even get all into the topic, we know we have a lot of ground to cover. Tell me a little bit about Warriors Heart and the population that you serve through that organization.
Thanks, Sherry, for giving me this opportunity to be with you and to share a little bit about Warriors Heart, which is a treatment facility. We like to refer to it as a training program for the warrior class, meaning military, active duty, and reserves, firefighters, police officers, emergency medical technicians, those people who've been on the front lines defending us either in our communities or overseas. And we help them recover from co-occurring disorders, psychiatric or behavioral health disorders such as depression, post-traumatic stress disorder, and also addictions, primarily alcohol use disorders, but also other substances.
And so given that May is recognized as Mental Health Awareness Month, it's a time that we in the media and other organizations, we place more heightened awareness on mental health. But overall, there is still a stigma, unfortunately, tied to folks that are actually seeking treatment for behavioral health issues. How do you address that?
Well, Sherry, you're absolutely right. And I think it's been as long as there's been mental illness, there's been a stigma attached to it. And, if you look at the word stigma, which means a mark of disgrace, it's particularly unfortunate as applied to people with behavioral health or mental illness issues because it's not anything that they've done. It's a condition that they have. It's a disease. And so just as we've overcome certain stigmas attached to physical illnesses, we still have a ways to go in overcoming the stigma that's attached to psychiatric problems. And those stigmas can come from society, people who are afraid of the mentally ill. They feel like they may be dangerous or they're so different than we are, which is an unfortunate myth. And it also comes from the self. People themselves who have the conditions sometimes feel that they are other than the rest of us, and it creates isolation, loneliness, and even despair.
Absolutely. And then one of the things that we know, Dr. Boone, that's come out of the pandemic is that we're opening up about a lot of things, from finances to back to mental health, how this whole crisis has really affected us. We've seen celebrities that have come out and been very open and public about their private struggles. Do you think that's been good for pushing this dialogue forward?
Absolutely. So, there are three essential ways that stigma can be combated. Perhaps the most important is education, just teaching people what we think that they should know with respect to the mentally ill. Another is protest. And so in a sense, the celebrities are on the front lines of that protest. Mm-hmm. We don't want to be ostracized any longer. We don't want to be discriminated against. We don't want there to be a prejudice against the mentally ill or those who experience addiction. And then finally, it has to do with contact, actually being with those who are experiencing depression, anxiety, post-traumatic stress, and realizing, look, they're a lot like we are. Mm-hmm. And as a famous psychiatrist from the early 20th century once said, we're all more human than otherwise. And that's certainly true for the mentally ill and those who suffer from substance use disorders. They're a lot like the rest of us. And if we have contact with them, that's what we'll find out.
And that was going to lead me to my next question. Is it, as you are certainly a licensed clinical psychologist, is this more just being human? Because I know in work settings, we sometimes say, oh, I need a mental day. But is it just more of being human? We go through, peaks and valleys in our life experience. So is this part of the process? Will we characterize it as being mentally ill, or is it just, hey, you just need a bad day and you need a day on the beach?
Sherry, that's a great question. I think it can be both. And I think, the behavioral health profession identifies certain conditions as adjustment problems, life circumstance problems, which can lead to changes in our emotions and the way we think about ourselves and our relationships. But let's face it, there are other factors at work, biochemical factors that create bipolar disorders and schizophrenia, and that is a separate category. That's a disease that requires specialized treatment.
Absolutely. Well, and Dr. Boone, throughout this whole pandemic, and as you say, you work with those that are on the front lines, tell us what you have seen in this profession as we hopefully get back to normalcy at some point in time. But what have you seen as you're working with these frontline workers?
Well, certainly the pandemic has affected both that population and the rest of us as well. Isolation is the big problem, Sherry. People who can't interact with their fellows, especially in the world of addiction, where recovery is so much based on the fellowship of the anonymous movement and other fellowships of recovery. When people are isolated and can't interact with one another, they're going to return maybe to the substances that give them comfort. And those substances, of course, will eventually destroy them if they're not careful.
And in the time that we do have remaining, Dr. Boone, are there some resources that you would lead our audience to? Is there a website, or are there some online resources that people can get some more information about?
Yes, there are. And for those who are part of the warrior class, retirees who may not have heard of Warriors Heart, it amazes me. This is, the world's #1 healing center for the warrior class, and yet many people don't know about Warriors Heart. We're situated in a small town in Texas. But I would recommend that they go to the Warriors Heart website for one. But, the National Alliance for Mental Health and the National Health Institute has a mental health branch. These are also, clearinghouses for information. And there is always the crisis line that people can use. 911 will put you in touch with some behavioral health professional who can get you to that next level of care.
Absolutely. Well, we want to thank you, Dr. Boone, for starting us off on such an important conversation for this segment.
Sherry, it was my pleasure. Thank you so much.
Absolutely. Have a great day.
Insights will return after these messages.
Welcome back to Insights. We're picking up our conversation on mental health. I want to welcome now Melissa Peters. She is the Director of Behavioral Health with the Judson Center in Michigan. Thank you for spending time with us.
Thank you for having me.
And we know that the Judson Center covers 5 counties in Michigan. Can you tell us a little bit about what you do there?
Sure. Yeah, Judson Center itself is actually a nonprofit human service agency that covers a multitude of services. We have several different service lines. I am particularly over the behavioral health services, which looks at treating those with mental illness, substance use disorder services, and then we also have integrated care as part of our practice, which means primary health care, really working with that whole person, treating the mind and the body. For our behavioral health services in particular, we do see the full spectrum: children, adults, older adults. We see mild, what's considered mild to moderate, maybe somebody just going through a tough time, a loss of a job, to somebody that's diagnosed with a chronic behavioral health diagnosis that is probably going to be with them for the duration of their life. And pretty much everybody in between. We provide family supports, psychiatric services, therapy, of course. We do have home-based programming for some of our county population, and kind of just meet the person where they are at with what they need to hopefully improve the quality of their own life.
Yeah, so you guys cover a wide swath of everything related to mental health. I like this on your website, Melissa. You says that behavioral health, we believe, individuals diagnosed with a mental, behavioral, or emotional disorder deserve high quality treatment in safe environments free of judgment or stigma. And so earlier we were talking with a Dr. Boone about the stigma associated with sometimes as folks are seeking treatment for behavioral health issues. How do you fulfill your mission that you have here on your website?
Yeah, being aware, having the awareness of the stigma still being present for those diagnosed with behavioral health conditions or even just seeking support for mental health is still so prevalent. And so I do think it's our duty as mental health professionals to continue the education, doing community awareness. I'm often doing presentations with local organizations and school systems, just giving some information. The more information we can share to help normalize mental health as far as how it is similar to physical health. These are things that in some ways can be managed by learning some new skills and medication, but in other ways is a diagnosis that's going to be with someone for their lifetime. And they need a support just like somebody with diabetes needs support, someone with cancer needs support. And to be able to provide an environment here at Judson Center that we're proud of, that we welcome people with open arms, that we are person-centered, which basically means that we meet them where they're at, which sometimes can be challenging if we foresee something that may be helpful for them, but they're not ready to go there yet, right? We still have to meet them where they're at and really embrace what it is their need. We have had experience. We opened up an integrated care practice with primary care a few years ago as a way to help bridge that gap and decrease the stigmatization that comes along with health, because mental health ultimately is wellness, it's your health. And so what our integrated care clinic really allows us to do is, yes, if somebody is coming in for a primary care need, chronic medical condition, what have you, we still assess for some mental health needs and vice versa. And we have internal teams that have the expertise to really wrap around a person and be able to support them in whatever they need to be supported in.
Yeah, so again, you guys do a lot of heavy lifting there. I always like to ask this question as we're coming through, hopefully, the pandemic. What are some of the challenges that you've encountered? We know that every day people have encountered a lot of challenges trying to maneuver this. So when it comes to mental health, what are some of the things that the organization is seeing?
Well, I think you're just seeing more increased need. You're seeing people struggling with the changes, back to work, not back to work. My friend is back to work, but not me, and really trying to navigate that. You have some of the logistical changes and childcare concerns, things like that. But then, of course, you have the stress that comes around with a pandemic. Is it safe now? Was it ever safe? Really trying to help people understand and navigate where they're at, their own anxieties, but that people are at different places on what they're comfortable with, what they are trusting as far as being comfortable with. And so we really are trying to meet them where they're at again and give them the support they need. What's interesting is when the pandemic first kind of took off last spring, and everything started shutting down, and Judson Center had to do a very quick maneuver from face-to-face services to telehealth, which we were able to do pretty successfully. For that first six or 7 months or so, what we found is actually higher engagement from our clients, meaning they were keeping appointments, they were scheduling more frequently, where in mental health, it is pretty standard to have around a 30% cancellation no-show rate, give or take. But during that 6 or 7 month time, we had under 10% cancellation no-show rate. People answering the phone, wanting to do the videos because they had so much going on and needed that extra support. So for us, that was, I think, something we didn't overly think about being as far as what could happen, but that was certainly a noticeable observation that the engagement was increased, the need was increased, and the willingness to work to reach out It was nice to see that the state of Michigan did such a strong initiative on COVID support lines and really kind of trying to, I'll use that word normalize again, normalize that it's okay to ask for help, that this is hard. And maybe that helped have people reach out more and stay engaged if they were connected to some providers, which was a good thing to see during all of this.
For sure. And in the time we have left, Melissa, what are some of the coping mechanisms that you would recommend for people as they are trying to still manage this crisis, this pandemic? Again, how would you suggest people cope? What are some of the coping mechanisms?
My advice and suggestion is step one, always be just self-aware, because I can give all the suggestions in the world on what is a good coping skill or what helps somebody else. But if it's something that isn't going to work for you, it's not going to work for you. So number one, really get in touch with yourself as far as what your stress level is at and being able to recognize when that stress level is increasing to be able to know, okay, I do need some support. So, I mean, the simple strategies that they sound simple, but of course, reaching out to friends, family, people you trust, getting some support that way through listening and talking, finding hobbies or activities that comfort you and make you feel good. And the more that you can do that proactively, the better, meaning don't wait until your stress level's up here to decide to read that story, have that book kind of worked into your routine, because the more you can be aware of yourself and manage that day to day, the less likely, at least some of the time, that your stress will get to a point of not being in control.
Yeah, I've actually heard that before. Try to find something that you enjoy doing to kind of take your mind off of the current situation. So, Melissa, we want to thank you for spending time with us today and carrying on this very important conversation.
Thank you so much for having the conversation.
Insights will return after these messages.
Welcome back to Insights. We're continuing our conversation today. Joining us is Bria Griffin. She is the Director of Wellness for Sprout. Welcome, Bria.
Hey, thank you for having me.
So I really want to delve into what your company does. I know the last couple segments we were talking about mental health and the challenges, some of the stigma associated with folks that are looking for treatment for certain behavioral health issues. But your company is focused on, and I'll just read from the website here, making well-being more accessible in the workplace. So given the challenges that we sometimes face, some of the stigmas associated to trying to make ourselves whole, how do you go about doing that?
Yeah, great question. So Sprout is a health technology company. So the way we work is basically by extending well-being programming through digital means. So your computer, an app that you would download on a mobile phone. So because we've made it so digitally and easily accessible, we can push through personalized programs to any of our users that would help them address mental health, physical health, nutrition, really whatever they need at that point in time. So we're able to do that through digital means with our well-being app and desktop accessibility. So the other thing that I always like to mention here as well is that we really do focus on the personalization. One person might need something that someone else doesn't really need. So we're looking to get people the right thing at the right time to help them where they are. And how we do that is by collecting information about what people are interested in, what they're doing, what they want to achieve, and then being able to get them content, programs, support at the right time.
And so I'm just talking a little bit about stigma. So in your experience, I know with the pandemic, we've lost so much, but in terms of employers wanting to bring this to the workplace, what has been the reaction to this? Because I would imagine that some folks are a little bit private about, maybe sharing this type of information or this type of need with someone maybe outside of their family.
This year has been really revolutionary for digital wellness because companies are more eager than ever to get something in place, and employees are asking for it as well. Employees are reporting that they are more burnt out than ever. LinkedIn actually ran a big survey almost across 2 million people and looked at employee engagement reports in previous years versus this year, and found that employee burnout was actually up by about 33%, which has huge implications for business, for for society, really. So because of that, these employers are really looking to have a technology in place, and employees are more willing than ever to use them, specifically because they do need some help themselves. They want to connect with resources. They want to be able to maybe reach out to their EAP. They want to know, how they can help moderate their mental health. But they also have this desire to continue to connect with their colleagues, those people that they maybe saw every day that, formed this special place in their heart that they just can't see anymore. So that digital technology keeps them connected with the company, with their colleagues, and helps them really protect their mental, physical health and overall well-being.
So let's dive into a little bit of maybe some of the exercises and what it looks like. So I don't know if the days of going off a company site and doing the whole team building exercises, I don't know if we'll ever see that again, given what we've gone through. But is this perhaps what you offer parallel to that in some sort of way?
Yeah, a little bit. So, there are a lot of social applications, or social features rather, within our solution. So users can, first of all, connect with each other in a community, for example. So I'm part of our Healthy Recipes community at Sprout. We use our solution internally. So I'm getting really great tips on healthy breakfast smoothies to make. Other people are using our events calendar to connect with people and do a yoga class together, socially distanced in the park.
Oh my God.
Yeah, exactly. So there's a lot of ways to connect with people at your workplace and do something healthy with them. So not only does that kind of help people stay on the wagon, but it really does help them feel more connected to each other, like they're not alone in this pandemic.
Mm-hmm. And that's what you said is the last two guests that we had, they both mentioned the aloneness factor. So this has really created time alone that we may not always have wanted. So what have been some of the learnings that your company is sharing as we maneuver our way out of this, hopefully?
Yeah, so I think some of the learnings that we've been able to see, both with the data that we can collect and with the feedback from employees, is that the companies who are really going to come out of this the strongest are the companies who are proactively addressing burnout, are listening to what their employees are saying and remedying that. So, good bosses can look for signs of burnout by recognizing some behavior changes in employees. Is there an employee who used to be really happy and bubbly who is maybe a bit more withdrawn? Is there an employee who maybe was introverted but now is agitated or missing deadlines? So the good bosses, the ones who want to come out of this strong, will be able to identify that and kind of remedy that before the world goes back to normal.
Right, because folks are actually coming back into the office. So this is a great time to start implementing these things.
Exactly. Yeah. And of course, with that comes a whole different set of anxieties, people returning to the office after a year and, switching up their day-to-day again.
Well, Bria, we want to thank you for spending time with us today. That's actually a perfect place to end it, as folks are getting ready to come back into the office in some instances. So hopefully they'll have that great boss that may recognize the potential burnout. So we really do appreciate you sharing a little bit more about what you do.
Perfect. Thank you so much for having me.
Well, that's all we have for you this week. If you have a question, comment, or story idea, we'd love to hear from you. You can email us at news@wbkb11.com. I'm Sherry Stewart. Thank you again for watching and have a great week.
Insights into Northeast Michigan is produced by WBKB News. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.